Welcome back. It is a Wednesday. That means Wellness Wednesday here on News 9, our segment to just help us all live a little healthier.
November is Lung Cancer Awareness Month. Joining us to talk more about it, OU Health's Dr. Matthew Reinersman. Thanks for talking to us this morning. We appreciate it.
Well, thank you for having me.
Absolutely. According to the American Cancer Society, the rate of new lung cancer cases in Oklahoma is significantly higher than the national rate. That sounds shocking. Why is that? What are the numbers?
Well, like you mentioned, over 3,000 Oklahomans will be diagnosed with lung cancer in this year alone.
Wow.
We are at the bottom in the recently released American Lung Association data on lung cancer. Part of it has to do with the risk factors for lung cancer, like smoking. We have a very high rate of smoking in Oklahoma. So that leads to about 80 to 85% of patients who develop lung cancer have a history of smoking or are currently smoking.
My dad passed away of lung cancer, and boy, it's devastating to families. He was a smoker for a long time, and he finally quit, but you know, it was a little too late, to be truthful with you. I mean, to stop smoking, nicotine's such a mean drug, but boy, your chances, if you can stop early enough, it does help in that you won't get lung cancer, correct?
Yes, we do know that if you can quit smoking, every year, every moment you get beyond that, your risk of lung cancer does decline. It very rarely gets back to someone who never smoked, but it does continue to get better, which is why it's a very important component of when we do lung cancer screening, which is a low-dose CT scan. We include in that counseling for why you should quit smoking and try to help people quit smoking and offer them those resources.
So early detection is obviously key here. What does that look like? A yearly exam? What does that look like as far as what people should do?
Yes, it is approved by all insurances. It should be approved by Medicare as well as Medicaid and private insurers. And what it is just a low-dose CT scan. So it's not even radiation that you'd get for a normal CAT scan of your chest. It's a much smaller amount of radiation. And what that does is it allows us to look at the lungs and look for nodules that could potentially be a lung cancer. And if we can find it early, we know that the survival rate or cure rate is upwards of over 90% if it's found when it's smaller than about an inch.
Wow. Wow. You talked about risk factors besides smoking. What's another risk factor?
Obviously being exposed to smoke, so if you live with someone who's a smoker, also there's some environmental exposures such as a gas called radon, and then there are some familial and hereditary, not well described risk factors. So if someone in your family has lung cancer, that might be a reason for you to consider getting checked out.
What's the #1 thing people should do, like if they're watching today and they're worried about their loved one possibly having some of these risk factors for lung cancer?
Well, the #1 thing would be to talk to their doctor or talk to your loved one and really encourage them to go talk to their doctor and see if they qualify for screening. So anyone who's over 50 that smoked for over roughly 20 years and still smoking or quit within the last 15 years, those are someone who would be eligible to get lung cancer screening.
Thank you so much for coming and sharing about this, and appreciate what you do here in the Metro.
You're welcome. Thanks for having me.
Thank you so much,
Thanks,
Dr. Matthew Reinersman from OU Health. We appreciate it.
All right, your time now 9:46.